Thank you all for joining us for the CUCSA year-end workgroup presentations. We will now hear from our Wellbeing Workgroup sharing their findings and recommendations. I'm pleased to introduce Workgroup Chair Jessica Bulleri.
Thank you for the introduction, Greta. I'd now like to introduce the Staff Wellbeing Workgroup members. We have Kelsey Duff from UCLA, Laleh Coté from Berkeley Lab, Mary Garcia from UC Irvine, Meenakshi Vedantham from UC Berkeley, and Kelli Breland from UC Merced. Our work builds on over 20 years of CUCSA work focused on improving well-being across the University of California system. In 2023 and 2024, CUCSA expanded the focus from personal wellness to well-being, which recognizes a broader framework that includes multiple pillars, including physical, mental, financial, social, community, and career well-being. With this framework, our workgroup examines staff well-being as a system-level driver of workforce sustainability. We believe well-being should be the responsibility of the organization and not just the individual. Well-being is impacted by leadership, policies, and workplace culture, and is critical for addressing burnout, morale, and retention challenges. With this in mind, our three focus areas for this year were flexible work, system-wide Okanagan Charter adoption, and evaluation of staff well-being online resources. Now I'll hand it over to Meenakshi.
Thank you, Jessica. I'm happy to speak about our first charge, which is the flexible work and how it can be positioned to help improve well-being. Flexible work should serve as a strategic business tool and not just an employee benefit. When it is really implemented thoughtfully, it can support organizational performance, talent retention, and sustainability goals. And then it also supports workforce design. How? By matching the work arrangements with the jobs and the team's needs. So flexibility can help also attract and retain talent by improving the employee experience and engagement as well. How about sustainability? It can also help advance sustainability goals because of the reduced commuting and office use. However, right now, flexibility metrics, unfortunately, are not integrated into the sustainability reporting, and it is primarily used as an HR practice rather than as a climate strategy, which is what we're hoping will change in the future. Also, the application of the flex work should be based on roles and recognizing that the flexibility varies across jobs. Finally, the success of this depends on alignment with the operational needs, the performance expectations, and service delivery of the organization. All right, so what are we recommending here? We're recommending a two-pronged strategy, one at the system level and one at the local level. At the system level, our recommendation is for UCOP to establish clear guardrails for flexible work to ensure there's consistency, equity, while still allowing campuses to manage their local operational needs. This really translates into standardizing terminology, setting role-based criteria, and also ensuring that there are clear documentation standards. There's written explanations for denials and a process for reconsiderations. So this will create fairness and transparency for all staff. Additionally, we're also saying supervisor training is important, and also collecting this data about system-wide participation in flex work would help improve accountability and also inform future decisions. At the campus level, what can be done? Local campuses already have the authority to strengthen implementation. They can publish clear eligibility guidelines, standardize their review processes, and ensure that the policies are applied consistently across similar roles. Okay, so while all this can be a big task to take on, what are we recommending here? We have worked on providing something to support CUCSA delegates and staff assemblies at this point with some practical tools and training that they can use right now. And this brings us to the Flexible Work Advocacy Toolkit. This can help in staff assemblies to advocate at their locations so they don't have to wait for the top-down action to happen. And they can also use our research and tools so that they don't have to reinvent the wheel. So if you look at the list of things or a preview of what we have to offer, there's a table of contents that also has fact sheets, reports, templates, emails, talking points, and policy checklists, which we hope can help staff assemblies. Now, a word of caution that I want to throw in here is that we're not saying that flexible work is an entitlement, and we're not advocating that it will work for every single job. It does not supersede any of the UC policies or the collective bargaining agreements that exist. All our goal is to move flexible work from a discretionary practice to a structured tool that can support workforce sustainability, equity, and employee retention. Next, I'm going to pass this on to Mary to speak about our next charge, the Okanagan Charter.
Thank you, Meenakshi. The Okanagan Charter, as some of you may or may not be familiar with, is an international framework that was designed in 2015 to provide institutions with common language, principles, and framework. It really aims to embed health into all aspects of a campus culture for students, staff, and faculty, and to lead health promoting action on a global basis. So recently, there's been a lot of momentum with the Okanagan Charter adoption and engagement with the campuses. System-wide engagement continues to expand, and here in our chart, you can see where each of the campus stands. So on the far side, we have all of those campuses who have already adopted, some who are reviewing materials, and one being the toolkit that CUCSA has provided them. And another UC Davis in reassessing in the coming year. And we actually just got an update from UC Santa Barbara as of mid-June 2026 that they are formally in the process of adopting. So we're really excited about all of the conversations that have been happening around the Okanagan Charter. One of those conversations has actually been with President Milliken, and we're happy to have his support in conversing with various chancellors on the different campuses and gauging support in that way. So we're hoping for system-wide adoption soon. Definitely the key takeaway here is that the dialogue is continuing to grow, and every campus is starting out from different points. So points and timelines. So we're hoping that once everyone is in alignment, they will be on board. So some of our research and analysis is as follows, is that adoption is a starting point, not an end point. So like I said, each campus is starting from a different place, whether that be they're adopted and doing, all of the measures that it takes, or they are still assessing whether or not their campus, will be moving forward. And so we think that implementation is really strengthened, and we've seen this from the campuses who have already adopted, by visible support and collaboration, shared learning, especially, coming from leadership, outcomes and metrics for accountability, and coordination across efforts. Everyone definitely measures well-being on a different scale. So we have found that those who are most successful have been able to create metrics for themselves to meet and to hopefully grow from. Potential challenges without system-wide coordination is fragmentation, and implementation could be difficult to evaluate and scale, dependent on individual champions rather than institutional structures. So we really are hoping that system-wide support is given to campuses who need it, and that we are able to systematically change within the Okanagan Charter and all that comes with it. So now I would like to pass it over to Kelli, who is going to talk about recommendations.
CUCSA is requesting that the Office of the President endorse system-wide adoption of the Okanagan Charter. This adoption would help us align and amplify existing well-being related initiatives and work groups. It would assist in developing shared outcome-oriented indicators and assessment approaches, and support would streamline reporting and cross-campus learning. Over time, we'd like OP to support campuses in building sustainable coordination and governance structures, dedicated implementation capacity where it's needed, shared expectations while preserving local flexibility, and most importantly, a common institutional commitment to health and well-being. CUCSA's Okanagan Charter work focuses on building system-wide momentum through broader campus adoption. Each additional adoption reinforces UC's collective commitment to well-being and helps create the conditions for shared practice, alignment, and sustained leadership attention. While adoption establishes the commitment, implementation is what embeds the charter into campus policies, partnerships, resources, and decision-making. Now Laleh will discuss online well-being resources.
Thank you so much. Using an AI foundation model, our work group did an in-depth search for all online resources related to well-being and wellness at every UC location and the UCNet central website. There are a large number of websites with excellent material, but we also found that there was information online that was outdated, inactive, or expired. A common example of this is a broken web link that does not take the user to a functional or active web page. Another example is content with a timestamp showing that the content has not been updated for many years. This outdated content could reduce trust and engagement of staff with the well-being resources across the UC system and make it challenging for them to locate information that they want to access. To support well-being goals across the UC system, our work group recommends that individual locations consolidate various resources into a central landing page to allow users to access all of the content at a particular location from one place, from one central web page. We recommend that locations use AI tools as research assistants to save time and locate online content that might be outdated. And this is a process that we used during the work group work this term. Finally, there are some locations that really highlight how well-being programs support institutional goals and truly make the business case. We believe this will be helpful to leadership and staff that are developing and really championing well-being initiatives across UC. There are so many initiatives currently happening at UC, and we hope that these recommendations will ensure that staff can efficiently locate and use these resources. And now I will pass it to Kelsey for our conclusions and calls to action.
Thank you, Laleh. To summarize and review our key findings, flexible work continues to stand out as a high impact and relatively low cost workforce strategy. It can support balance, retention, and resilience, but the staff experience remains uneven because implementation varies across locations and departments. The Okanagan Charter provides a broader framework for connecting well-being, equity, sustainability, and whole person health. At the same time, campuses are at different stages of readiness and engagement, so system-wide support should account for these differences. CUCSA's Okanagan Charter work builds system-wide momentum through broader campus adoption. Each adoption strengthens UC's shared commitment to well-being and creates the foundation for implementation through policy, partnerships, resources, and decision-making. Finally, access to well-being resources depends on visibility and reliability. If online resources are outdated, inactive, or difficult to navigate, staff are less likely to use them. Regular content review and maintenance would help ensure existing resources remain accurate and actionable. Well-being is a core institutional responsibility. It's not an optional program or individual benefit. For UC staff, well-being is shaped by the conditions under which people work. whether flex work is implemented equitably, whether workforce management is aligned with broader institutional goals, whether whole person health is reflected in policy, and whether staff can actually access the resources that already exist. CUCSA's interest sits at the intersection of all of these things. Flexible work supports workforce sustainability and helps advance other UC initiatives and goals like climate and commuting goals. The Okanagan Charter offers that unifying framework for health, well-being, equity, and sustainability. And resource access is what determines whether these commitments are visible, usable, and actionable for staff. To be successful, this work needs policy coherence within our delegated authority structures, stronger system-wide coordination, and clear leadership accountability for implementation. The intended outcomes are both workforce-centered and institutionally strategic. When well-being is treated as part of how UC operates rather than an add-on, we expect to see improvements in retention, workforce sustainability, morale, engagement, and equity. This work also strengthens UC's position as a leader in healthy and sustainable workplaces. By connecting flexible work, well-being, equity, and sustainability, UC can model an integrated approach that supports both its workforce and its public mission. These outcomes matter because staff experience directly affects institutional effectiveness. Staff are the people who sustain operations, support students and patients, enable research, and carry out the daily work of the university. The next step is alignment. CUCSA is not recommending working outside existing governance structures. Rather, the goal is to advance recommendations through the appropriate system-wide and campus channels, while respecting delegated authority and local implementation realities. CUCSA can continue to play a constructive role by monitoring the staff experience, emerging trends, by sharing promising practices across locations, and supporting implementation conversations where the staff voice is needed, which is in most places. System-wide leadership, campuses, HR, sustainability teams, wellness partners, and staff assemblies all have distinct roles. CUCSA can help connect those efforts so well-being priorities are translated into practical, consistent, and accountable action.
For more information, be sure to see the full workgroup report that is linked in the video description. We would love to discuss our recommendations with you at the CUCSA Town Hall on Tuesday, July 7th at 11 a.m. Full details are available on our website at cucsa.ucla.edu, or you are welcome to email any questions about our recommendations to me at the email included in the description. Thank you.